Good afternoon, everyone. I'm Carmelita Nuki, the Executive Director of DAWN and the President of the Philippine Migrants' Rights Watch. I will be your moderator for this afternoon. And as a background of our webinar this afternoon, the COVID-19 pandemic has affected all sectors of society, including migrant women, returnees, and those in the destination countries, displaced from their respective workplaces. A major issue that they are currently confronted with is a mental health due to distress and possible trauma brought about by the pandemic. Many migrant women workers were forced to return home scarred or trapped in the country of destination, afraid and anxious for their individual welfare and well-being, as well as that of their families. Our October webinar series were held with our migrant women returnees and migrant women workers in the destination countries and their families to address these issues. To facilitate, assist, and address the pressing concerns of the individual migrant women returnees and migrant women workers and their families, the second series of webinars will focus on the training of service providers. The series of webinars aim to enhance the existing skills and capacities of service providers on mental health and psychosocial support services in order to effectively respond to migrant women returnees and migrant women workers in the destination countries and members of their families amidst the COVID-19 pandemic. Second is to identify current issues and challenges experienced by service providers on the area of mental health and psychosocial services. And then we also have to identify and strengthen the appropriate response and support mechanisms among service providers. It is in this regard that we invited you to this 4-webinar series organized by DAWN in partnership with the British Embassy Manila. The first of which is the webinar on mental health and psychosocial support, psychological first aid, stress management, and coping strategies. We would like to thank you, our welfare officers, social welfare attachés, the DSWD regional field offices, social workers and staff, representatives of NGOs and recruitment agencies for joining our training workshop this afternoon. We hope that we will have a fruitful discussion. Thank you very much. And now, to formally open our webinar, we would like to call on Professor Aurora Habati de Dios, the President of the DAWN Board of Trustees and the Senior Project Director of the Women and Gender Institute or WAGI, to give us the welcome remarks. Oyi, please.
Okay, magandang hapon sa ating lahat, lalo na sa mga participants natin from the embassies abroad. I know that we have several coming from our OWA officers as well as NGOs. Welcome to everybody. This is part of the series of webinars, as Mel mentioned, to provide some degree of assistance to our frontliners, particularly those dealing with mental health issues at this very crucial time of the COVID crisis. For those of us in the Philippines, we know that this COVID crisis is compounded by, a series of typhoons that have impacted on the country and is still causing a lot of suffering, at least in major regions of Luzon and the Bicol region. This particular attention that DAWN is paying is focusing on is part of its advocacy and work to assist in the welfare and well-being of migrants everywhere. It's an old organization, or 20 years, more than 20 years old, has started as a program to assist Filipino entertainers in Japan and their children. But it also eventually covered all of the women migrant workers returning to the Philippines or about to go abroad. So as we know, the Philippines is one of the top migrant sending countries, where we are sending Filipino domestic workers who are found in homes from Saudi Arabia to Italy and in Southeast Asia, in the rich countries of Southeast Asia. And our nurses in London, Jeddah, and New York are, of course, nowadays acting as the medical frontliners dealing with COVID. And we have thousands of workers and engineers in oil refineries in the Middle East. So we know that migration was initially thought of as a temporary measure, has now become a permanent fixture of our development strategy because we are approaching the 50th year of our migration. Because of this, the Philippines is considered as one of the most varied diaspora, meaning we are all over the world, that has emerged in the 21st century. The COVID-19 is quite unique in that it is global in coverage, in reach, and it is it's becoming like a pandemic that will last for years. I'm not very optimistic about when it will end, because it will always be there. We almost like reaching 1 year and there's no end in sight. In the past, crises such as political conflicts, as well as health pandemics have happened before, like SARS, but they were temporary and they were localized. COVID is different in that it covers both the sending and receiving countries. And this has a lot of implications to our migrants. And of course, we know that in the process of dealing with this problem, a lot of receiving countries have turned to more restrictive measures, even ending the employment of sudden dismissal of workers, which has caused tremendous and massive return of our migrants. And the second thing that also means is that there is no quick solution to this, because everybody is suffering economically. So this series, I think, has this pandemic has demolished all our expectations and our aspirations in life, of the aspirations of our migrants for a stable, long-term solution to their economic problems. And of course, added to that is a permanent fixture of our environment, which is that every year we have this series of typhoons that demolish our houses, roads and bridges, and almost always destroyed our agricultural crops. So that's a given. So you can imagine the anxiety, the stress, the suffering of our migrant workers who are totally dependent on their income from migration. So I think that many psychologists and many people are saying, if you cannot change the problem, you have to change your attitude towards that problem, and that's the only way to cope. And for us who have been used to suffering, I think one of the things that we have neglected or did not acknowledge is the stress, the anxiety that can compound our mental health. So Dawn has introduced this series of programs, in order to, in one way or another, in some small way, we can assist, especially our welfare officers and our frontliners, not only to deal with clients, migrants who are, as I said, under a state of anxiety and serious stress, but also among our caregivers, our welfare officers who themselves have to bear the burden of helping others. So I hope this series of talks and this particular afternoon webinar that we have can be of assistance to all of you, to our migrants, and to all our NGOs that are trying to do their bit in order to alleviate the suffering of our migrant workers. Salamat po at magandang hapon.
Thank you very much, Oyi, for that message. And we hope that, we will further have fruitful discussions during this webinar. And now, let me introduce to you our two distinguished speakers for this afternoon. First, we have for a while, please. Yeah. Sorry for that. Yes. Our first speaker is Dr. Juris Prudencia. He's a practicing licensed clinical psychologist and a licensed guidance counselor. He's also an associate professor and a former chairperson of the Department of Psychology of Miriam College. As an educator, he was a recipient of the President's Award for Teaching Excellence, the highest Miriam College Award in the tertiary level. He also received recognition from the Center for Educational Measurement and a sought-after resource speaker. Dr. J was also a board of director of the Psychological Association of the Philippines for a couple of years. He obtained his PhD in clinical psychology from the Ateneo de Manila University and his Master of Science in Guidance and Counseling from the De La Salle University. He is an advocate for women and children, a proud father of 2 daughters, and an internal migrant. That's Dr. Juris Prudencia. And the second speaker is Dr. Nhpss Agkawili Manaligod. She is a certified developmental psychologist and a registered guidance counselor and psychologist. Currently, she teaches psychology and guidance courses at Miriam College. She served as department chairperson for the graduate school of the College of Education of Miriam College from 2010 to 2020. She was a board member, an executive secretary and treasurer of the Psychological Association of the Philippines from 2010 to 2016. She was vice president for academic affairs at the Colegio de San Lorenzo in Quezon City and also served as the vice president and member of the Board of Trustees of the ADHD Society of the Philippines. She has published a book titled Educating Children with ADHD, The Philippine Experience. She received her doctoral degree in Child and Family Studies at Miriam College and a Master's of Science in Education Measurement and Evaluation at the De La Salle University, and also completed her Master's of Arts degree in Guidance and Counseling. She holds a bachelor's degree in psychology at the College of the Holy Spirit in Manila. So now let me call on Dr. Juris Prudencia for his presentation. Dr. Jet, please.
Thank you for the generous introduction, Ms. Mel. Before anything else, I would like to thank the British Embassy for sponsoring this webinar with Dawn. And I am also happy to know that our welfare officers from the different countries, almost 10, are also here present. And we are also very lucky to have some NGO service providers who are very much interested to participate and to contribute to the well-being of our migrant women workers. Okay, so I hope this webinar will really be of help to you. And I think this webinar will be covering, because this is MHPSS, Mental Health and Psychosocial Support, will not just simply be covering our migrant workers, but will also include the other aspects of disaster so that you can really apply the principles wherever you will be. Okay. Ms. Shane, can you please share the first video?
Ako nga talban na gamit.
Emosyonal si Marilu sa tuwing maalala kung paano siya natrap sa bubong ng bahay sa kasagsagan ng Julius sa Rizal. Kahit man, tuloy ang kanyang kalbaryo sa evacuation center.
Hindi may alam kung paano gawin yung pinasal wala ko. Pagbilin ng pagbilin, wala. Wala.
Kasi nga ang bata, pero wala mo.
Kasi ang hospital kailangan benefits na gamot. Kung tapos na gamot ang Nhpss siya, kita hirap ako yan.
Ay, magpapaganda. May kasya sa bagay ng
Ay, kasi wala po akong panty. Nakikita ko sa inyo. Tulungan niyo po talaga sir. At mag-supply, di na po nakakapasok. Wala po sa ligo-ligo.
Halos 14,000 individual ang nanunuluyan sa 16 na itinalagang evacuation center dito sa Rodriguez Rizal. Siksikan, walang kuryente, walang tubig at limitado ang dumadating na relief goods.
Kasi sa lahat nga sir, bibig na kakilakit biyahan kasi yung iba yan wala.
ang mga bata dito sa pulis na eskwelahan. Ito na rin ang pinagkukulang nila para ipambuhos sa hirap ng sitwasyon. Hindi ba iwasan isipin ng residente kung nasaan ang kanilang
Sana may tulungan yung kapatulog. Kasi bang namin lang ang mahal.
Sa video sa Facebook page ni Leo Fernandez ngayong araw, nakita ng kanyang grupo ang pagbigay ng panghalang ng relief goods. Pero higit sa relief goods, ng mga residente ang pagkakalan ng tulong tulad ng relokasyon. Mahigit hindi mo pa ang mga kuryente sa bilis ayon sa Kerato. Kapag sisipin ng Manila at Manila Express sa Kailan, nagtayo na sila ang water taggers sa evacuation center. Mahigit so, ABS-CBN News.
Thank you for that video. If my connectivity is okay. Okay, because the video is choppy on my end.
Medyo choppy nga din dito, Doc Jerry.
So, but how is my coming in? Is it?
Yeah, ngayon po, okay, clear po.
Okay, so thank you. So why did we have that kind of video? Okay, so it is not simply to show us what happened after the Typhoon Ulysses. These very people may also include our women migrant returnees. Okay, so they may be home, especially those in the areas of Montalban, Marikina. So they came home with all the hopes that they will be with their families. And now this is what they get. No? Exactly. So we just can imagine the difficulty and the pressure that many of them are facing right now. So this may not be like in other countries, our migrant women workers in destination countries, but definitely if we are faced with a disaster or a crisis like this, okay, for many service worker providers, what will you expect? Okay, so just imagine we were visited by different crises already, like the Taal eruption, even with the pandemic. So you can just imagine there were no face shields, no the social distancing, and definitely you expect that they will not simply be losing their homes, but they may also be losing their lives because they will be exposing themselves to mental health crisis. Okay. So, but before that, let me, Ms. Shane, can you please go back to the first part, okay, of the slide? Okay. Now, what is this training for? Okay. So this training is really to help our volunteers, our service support providers, how to approach the different situations, but at the same time without risking their lives. Okay. Also, how will they address, you know, and show support for our very people who needs our assistance, our distressed migrant women workers, other people who are in crisis or in disaster areas. And at the same time, when we are doing and assisting help, we have always to be conscious that we should not add to the problem. No? We should not harm our recipients, the people who expect that they will be assisted. So let us bear this in mind when we go through this webinar training. Okay, Ms. Shane, can you now? Okay. So what other crisis did we experience? Next slide, Ms. Shane. Okay, so not only that, we are already in the pandemic, and yet we also experience recently fire in several areas of Metro Manila. And again, our people are all placed in one area wherein safety is disregarded. Okay, I hope our migrant workers are not one of them. But definitely, if they were also victims of this kind of calamity, definitely many of them will find themselves in the same situation. Next slide. Okay, so just recently, Typhoon Ulysses also added to the woes of Catanduanes in Albay. So by bringing so much water inland, destroying crops, once again, may our migrant women returnees not one of those, because they just simply came home, okay, thinking that despite the calamity, despite the pandemic, they will be able to rebuild their lives. But here comes again another challenge, no? This typhoon that brought so much flooding in their homes. Okay, next slide, please. So these are just a few of the photos that would show us how our people are affected by Rolly and Ulysses, no? Okay, and definitely, as I have said, many of them or some of them are also women migrant returnees. So this may not be the experience of those who are still in other countries, but definitely their loved ones may also be suffering. So they may be still there, but I know that they too are worried about the situation of their loved ones, especially if their loved ones are in places where Typhoon, Rolly, and Ulysses visited just recently. And not only that, even the water releases in the different dams may have affected their homes and flooded their livelihood. Next slide. So what about those women migrant workers in other countries? What are they facing with at this point in time in their lives? Of course, one of the fear they have that is like a sort of Damocles, ready to fall in their lap is the loss of livelihood, the fear of not having a job and money to send back home. Okay? And aside from that, they are also, like many of us here in the home country, are faced with health and safety issues. And sad to say, some countries are not even supportive. They would rather prefer their workers than take good care of the health of foreigners, especially domestic workers coming from other countries and working in their own country. Okay, so many of our migrant workers don't have even medical insurance, health support that will assure them that it's okay to stay there. And above all, what was very painful is the fact that they are not only afraid of losing their work and their job, but they are also constrained when it comes to how much money they will be sending back home. Okay, because they are also stranded. And if they had been working for 5 days before in the pre-COVID time, now they may only be working 2 days in a week or less. And therefore, perhaps the amount that they save may not be enough to even support themselves and send back to the Philippines. So the remittance is a big issue, okay? And definitely this will be a big headache for many of our migrant women workers and migrant women returnees. If you just watch that video, okay, if you are hit, if your place is a calamity area, so just imagine you lose your homes, no more, nothing safe at all, cars, documents, livelihood, and so etc. And add to that, you cannot expect some financial support coming from abroad, from your loved ones, because they too need this money. So, and added to this as well is the greater risk and for abuse and exploitation. Our migrant women workers in destination countries are also at risk of being exploited. The employers know that they have nowhere to go, and therefore they have to beat the bullet by offering them less in terms of salaries. Next slide, please. So what else do they experience? Okay, so not only is their job threatened, even their visa and the fear that they will be deported. Okay, unless there is an employer who will support them, like in Lebanon. If there is no employer who will support your stay, you will be forced to go back home. And this is what our migrant women workers are afraid. Okay, they don't want to come home a failure. Perhaps they left the country with so much debt, umutang sila ng katakot-takot, and just to be back home, brought home will be a shame to them. And therefore, this will be a kind of pain that will add to their anxiety and worry. And added also to this, they are not even sure of the support services. They are in other countries, but how much support do they get? Do they get enough support from the embassy? Do they get enough support from the NGOs, the community, the Filipino communities? Are they there? Or perhaps they may get support, but the support may not also be enough. So not only that they don't get support, they are also afraid that they might also be the cause of spreading or infecting other members of the community, no? Because they may be vulnerable to COVID-19. And so if they know that you get one, added to that is the stigma. No? So people are scared, even the employers, when they know that one domestic worker had COVID-19. So they kick him out in the street. Okay, they had no qualms. No, they don't care because they can always get a replacement for this. No, the same thing in Hong Kong. No, there were several. They were left on their own, and the complaints of our migrant domestic workers were that even the agencies back here in the Philippines cannot even send them support. So they were left in the care of Filipino workers who themselves were also experiencing so much financial constraint. Next slide, please. So now, so before we start, okay, you can screenshot this, okay? In 1 minute or two, please answer the questionnaire. Let's see if you are really prepared to face what it is that is waiting for you when you want to assist people in disaster areas or our migrant women workers in the foreign country who will be flocking to your centers. Okay, so Ms. Shane, can you time after 2 minutes you tell me? So you answer, okay? You can please get your paper and ball pen. You don't have to copy, screenshot it, and then just put your answers because later on we will give the answers and check if you really did know exactly how to address some concerns that are mentioned here. Okay, Ms. Shane, can you start the time now? Okay, so answer with a yes or no. There are only 15 items. Okay, for this. Ms. Shane, can you give me a cue for the time?
Yes, Sir Chair.
Okay. So you start answering. Okay, don't have to be too serious. If this will not demand deduction from your salary if you don't perfect this. But at least you will know exactly where you are coming from when it comes to how to handle situations, crisis situations, and people in disaster areas, no? Including our migrant women workers and returnees. Okay.
Sir J, tapos na po.
Okay, so thank you. So just hold on to your paper and we will give you the answer later. So after getting a screenshot so that you will be able to check whether you really understood what was expected from you, volunteers of MHPSS and PFA, when you find yourself in areas that need your assistance. Okay, next slide, please. Now, this is another 10-item question. Just write true or false. Okay. For each item, you don't have to stay long. Okay. You may also screenshot the question. Just write T for true or F for false. Okay. In 30 seconds, perhaps you can finish this. Let's see how much do you understand mental health. Ms. Shane, give me a cue if 30 seconds are over. Don't stay long. Just answer it spontaneously the way you understand the question. You don't have to, okay? If they are done, we will go to the next slide. Ms. Shane.
Okay na po.
Okay, next slide, please. Okay, so that's the first 5 and the second 5. So the same thing, write T for true or F for false. Okay, the way you understand the item, you don't have to stay long. 30 seconds. So this is just simply a review, a refresher course for those who may have gone through this before, just to refresh your memory perhaps. Or for those who are new, this will be a challenge, especially for those who want to volunteer and offer their services to our people in disaster areas, especially for our women migrant workers in foreign countries. Okay, if you are in an NGO in the center. Okay, is 30 seconds over, Ms. Shane?
Yes po.
Okay, now, so let's find out what is the answer to this. Next slide, please. Now, the answer to all those 10 questions in mental health is false. In other words, they don't have basis in reality. If you said true there, that means to say you still have a myth, okay, that you are holding on to, thinking that this may be true, when in fact, they are false, okay? So, but don't be sad. At least you know where you are coming from, okay? Because that's very important, just to check, no? Because you cannot give what you do not have, no? You cannot offer unless you yourself is not knowledgeable of what is expected from you when you work in a situation like this. Remember, it will be very chaotic, okay? People will be going to you. They are all crying. They are all in need. So if you are not prepared, you might get overwhelmed, okay? So you should know what is it exactly that you have to do, okay? And presence of mind is very important here. Next slide, please. So what do we expect from this? Why is this very important, mental health? Because mental health has to give us the value of life is important at all costs. So we have to preserve life if you want to be assisting people in disaster areas. You have to remember that people may be losing hope, so you have to prevent deterioration, okay, of mental health, okay, and that your presence there will promote recovery, okay. So this is very important if you are to offer your service to those in need. Always think of these 3. I am here to preserve life. I am here to prevent deterioration of mental health. And I am here to promote recovery and give them resilience and inner resource recommendations. Okay, next slide, please. So to understand the value of your work there, if you want to do no harm, you have to understand the meaning of mental health. Okay? So what is mental health according to the World Health Organization? Mental health has 4 elements. Okay? The person who has mental health, if he or she is able to realize her potential, her abilities, that's one. If the person is able to cope with normal stresses that come along her life, or if ever there are stresses there, at least she can still bounce back. Third, that she will be able to work productively despite the challenge. And that 4, that she can still contribute for the good of the community. So when you talk of mental health, okay, don't equate this with he is simply sick. No? So some people would say, mental health, may sakit yan. Okay? He's physically sick or may sira ang ulo niya. No, that is not the meaning of mental health. The meaning of mental health is has 8 different dimensions. That's why the imagery that symbolizes mental health is a wheel, gulong, okay? And it includes emotional, intellectual, physical, social, etc., spiritual, okay? So another term for mental health is also well-being or wellness. So if you hear of this word, they simply mean exactly the same. Now, why is it a gulong? Because like a car, if there is no gulong, it will not run, okay? You will be stuck. So the gulong will facilitate your movement. And if the gulong is well inflated, you will have a very comfortable ride. Now, what happens if the gulong is deflated or lacks air? So kulang ka halimbawa sa physical, you get sick, and it will affect the other dimensions of your health. So you cannot think well, you cannot perhaps feel assured, you are always anxious, you are always fearful, etc. And so that will lead to your getting sick. No? Kaya it will totally jeopardize your well-being, your wellness. Okay? So this is very important. Next slide, please. Next slide, Ms. Shane. So which one are you focused on? Okay? So some people are simply focused on the physical. Some people are simply focused on the financial. No, trabaho lang ng trabaho, no? Workaholic. They don't take care of their health anymore. Or they don't take care of their environment. Nakakasakit na sila tuloy, no? Kasi their environment is not healthy. Or they work and work, but they don't anymore build relationships with other people. So walang social health. Okay? So sa ibang bansa nga sila, pero wala naman silang kaibigan. So they isolate themselves. Okay? So if they hear news back home, which is not pleasant, they easily get vulnerable. Okay? So you have to consider everything, okay, as your wealth, no? In terms of mental health. Next slide, please. So because we are thinking of mental health, okay, now we have to go to the term PSS, the psychosocial. So why is it that MHPSS? Because when you are doing and assisting and helping people, there will always be 2 elements that will assist them. First, you have to look at the person's or the victim or the recipient's psychological condition. How do they think? How do they feel? How are they affected? And you just don't simply look at the psychological, but you should also look at the social factors. Who are the people giving them support? Is there a community? Is there a family that they can run to? So in other words, when we are thinking of mental health, we also think of the social support. No? Kaya psychosocial support is an approach that aims to promote resilience of individuals, of groups, of communities, wherever you are. Okay? So this is very important. Okay? So when you talk of mental health, you should also open yourself to the possibility of not only helping the person to stand on his 2 feet, but at the same time providing him or her the clutch wherein he or she can sustain, you know, herself. Okay, next slide. So what is the meaning of NHPSS then? Okay, so MHPSS is nothing more than either a local or outside support that aims to protect and promote the well-being and welfare of the person. So if you want to apply MHPSS, you have to think first, how will I be helping this person? And second, what are the support system that will assist this person to be resilient. So that's why when you think of MHPSS, whether you are in other countries or whether you are in the Philippines, okay, this will always be at the back of your mind. Next slide, please. Now, who are the people who needs MHPSS? Okay, as I have said, MHPSS is a humanitarian action, and this is applied to emergency situations. So just what we have right now. So the video that we had at the start, no? Natural disasters. It can also be man-made calamities, no? Like, for example, mining, okay, cutting of trees, no? Yun ang nangyari doon sa Isabela. So nadagdagan pa, okay? Mayroon ng global warming, dinagdagan pa ng mining, dinagdagan pa ng illegal logging. So very disastrous. And so this also include detained migrants wherever you are. And this also covers people with disabilities, people who had been suffering from mental health problems. So even our migrant women workers may also be not only healthy, but they may also be keeping this to themselves, no? And especially children who are separated from their families. So like, for example, if you meet an accident, no, you can also apply MHPSS, okay? Next slide, please. So what are the elements of an MHPSS when you use this as an intervention, whether in countries of destination or here in the Philippines? First, you should always think of the safety of others. But of course, the assumption there is before you give safety, you should also be safe as well. Okay? Oh, remember the metaphor of the falling oxygen mask. Okay? In an airplane. Bago mo ibigay ang oxygen mask sa katabi mo, especially sa mga vulnerable, sa bata, sa matanda, ikaw muna ang susuot ng oxygen mask. So you can only secure safety if you yourself is safe as well. Okay? So paano nilang sila matulungan kung hindi ka rin safe, no? Second, you enhance connectedness. You know for a fact that many of these people may be disconnected, especially from countries outside of the Philippines. No, they don't have load, or they don't have money to buy, okay, and load and connect with their loved ones. Or for those who are in disaster areas, no, sira ang connectivity, natumba yung mga poste, okay? May poste man, wala namang kuryente. May cellphone ka naman, wala ka naman kuryente. So people will really panic. That's why your presence will also be a calming effect. Okay? And definitely, you are there to ensure that group support will be effective. No? Hindi ito kanya-kanyang tulong na bahala ka sa buhay ni Batman, kanya-kanya magbigay. No. It has to be a collective effort. If we want to help more people, it has to be a collective effort, not an individual effort. Because this is the only way by which people in disaster areas, our migrant women workers, may sustain their hope. Next slide. Okay. Now, what is psychological first aid? Okay, so ano ang kaibahan? Is this the same with MHPSS? Psychological first aid is simply included in the MHPSS. Now, who can practice this? Okay, people who can practice this need not have licenses. No, you don't have to be a licensed psychologist. You don't have to be a licensed social worker or a licensed guidance counselor, etc. Anybody who is willing to assist and support people in disaster areas can apply psychological first aid. So what is very important here is that you are there to give calm, you are there to give hope, and you are there to ensure that no harm will befall the victims. So no need of a degree, okay? So it is a compassionate, non-judgmental way of assisting or extending help, okay? Now, so don't ever think that psychological first aid is debriefing. This is not debriefing, huh? Okay? You are not asking the person how she felt when it happened, describe the condition, etc. No, you are simply there. No judgment, no interrogation. You are not even there to give counseling. So psychological first aid is simply to make your presence be an affirming presence to those in need. Okay? So, so remember the first elements. You are there to ensure that no harm will befall the victims, that you give calm, you give hope, and that they feel that they have people to support them. Okay? So next slide, please. So what is very important here? What do you need, especially for those who will volunteer? No? Okay, kaya as I have said, no, nakita nyo ng sample kanina, no? When you are in a disaster evacuation center, okay, people will delude you. No? So first, you have to prepare yourself. Okay, first you have to take care that you are not overwhelmed. So so the first question you will ask yourself, for those who are willing to help, so you just don't bring your clothes there, you just don't bring but am I ready to help? Okay, so that is the first thing that you have to ask yourself. Am I willing? Okay, so what kind of safety do I prepare so that I don't get overwhelmed myself? Kasi there can be what you call vicarial traumatization. By simply listening to what the people went through, you might also get traumatized. Okay? You might also have nightmares at night. Okay? So kailangan matatag din ang resilience mo. Okay? And then, when you think you are ready, can I stay there physically and emotionally healthy to these people? Can I support my colleagues too? So remember, you have also to be at the lookout of your colleagues. Kasi minsan, no, if you simply forget your colleague also, baka nadadaganan na pala siya, no? Overwhelmed na siya. So he might even do more harm than good to people who are in need. Kaya you also have to be at the lookout, no? Not just yourself. And after, now, I have also to take care of my rest. I also have to recover. I also have to reflect. What did I learn from this experience? Okay, because they will be asking so much from you. So how far can I give? How far can I extend help? Kaya it's important that you just don't go there alone by yourself. You have to attach yourself to an organization. Okay, you have to be brief. Okay, you have to be oriented as to how to handle situations like this. No? I remember one time during the Tacloban crisis when we were in Villamor, no? When the people from Tacloban were arriving, brought by the American planes, iba yun ng mga volunteers, instead of ushering the people from the airplane to the centers where they can eat, ang iba yun nagbibigay na ng rosary, no? Magpe-pray na. So that is not helping. They are not there to pray yet. They are there to be assured that their tummy is filled. No? Kasi gutom sila. Wala silang nakain. No? So you don't give them rosary. Yes, rosary is good. Prayer is very helpful only after their physical health is already addressed. See? So sometimes you are so eager to help, but instead of helping, you're even doing more harm. No? Lalo na kung hindi pala Katoliko yung tinutulungan mo. Kung Muslim pala yun, So makwan pa. Makwan pa siya. Embarrass pa siya, or he will even be insulted because you are not particular, you are not sensitive. Okay? So this is very important. So just think of what you can control. You can control your thoughts, your words, your actions, but you cannot control what people think, what people feel, how do people behave. So be at the lookout on this. Next slide, please. So when do you use mental health first aid? Okay, anong kaibahan nito sa psychological first aid? In some aspects, they may be similar, but the difference is you are at the lookout for people who may be suicidal, who may be mentally compromised. Okay? So yun ang kaibahan ng mental health first aid sa psychological first aid. Okay? So if you are not trained to identify, then you refer it to colleagues who may have the training, like the psychologists, like the social workers, like the guidance counselors, or any other government agencies, okay? So that they can assist the person, okay? So here, the person who is applying mental health first aid is already at the lookout of those who may be suffering from chronic mental health conditions, okay? Like when you talk to them, they will be telling you about hopelessness, or that they seem to be breaking down. So it is already a sign that they may be losing hope. So if you are a psychological first aid volunteer, right away you tell the person, okay, ma'am, may I refer you to somebody who can really talk to you and assist you, okay? Because this is very important. Okay, so this is the difference between PFA and MHFA. Okay, next slide please. So dito makita nyo ang pyramid, no? So the PFA volunteer may assist in giving services like security of the people, see to it that they have water to drink, see to it that they have food, see to it that they have clothes, and then see to it that they connect with their loved ones. Okay, where to go if they need load, where to go if they need recharging of batteries, what local government unit will they go to if there are representatives. So your presence there will guide these people, no? Okay, or non-specialized support, like if they simply need your presence, no, while they are looking for their, for example, relatives. So you cannot leave children to be on their own. So you will be assisting them. Okay, you put them in a far safe place, and then assure them that you will be there for them while somebody is looking for their family, perhaps, or the name that they mentioned that needed to be contacted. Now, if there is more serious concerns, then this is where the mental health first aid comes in, okay? So there will be other volunteers who are trained for this, like the Red Cross personnel and other licensed professionals. Next slide, please. So what is the focus of PFA? So your concern as a volunteer will simply look at what is the loss of this person in terms of home, in terms of basic needs. Now, how severe is the grief? Of course, definitely, when you are in a crisis situation, you will always be grieving. Okay? Did you lose a loved one? Did you lose a very precious document, etc.? And definitely they will be stressed. Okay? And perhaps they may be experiencing some overwhelming unpleasant event. So this is the coverage of those who are applying PFA. Now, for those who are applying MHFA, now, what will be your concern? So while you go around, perhaps, while you talk with the individuals, you see to it that they will not be bringing concerns like thoughts of suicide, thoughts of ending their life, or if they are compromised as well, like they are substance-related compromised, or if they have other mental health conditions, like they are depressed, no? Or they have already past trauma, like naundoy na, pumunta lang ng abroad, na-traumatized pa, na-rape pa. So imagine this, so that can lead to even psychotic symptoms. So this is the lookout of people who are applying MHFA. Next slide, please. Next slide, Michelle. So what do you prepare? So for the principals, for those who are volunteers, okay, especially if you will be sent back home to your provinces wherein Rolly visited your region, or you are volunteering for Julius's evacuation centers. So first, prepare yourself without harming yourself and others. And then look at these three important principles. They start with L. Look, no? Who are the people with urgent needs or in distress? Second L, listen as they express their needs. Even if you know their needs, you still have to ask just to confirm or validate if this is exactly what they need. Because you may be saying something that they don't need at all, and let them stay calm. And third, you let them connect with loved ones. So tell them who are the people that they can approach to have access. Because, like for example, if they have some concerns with the SWD, if they have some concerns with the LGU, if they have some concerns with the barangay, if these people are also in the area, then you can assist them. No? Now, what about the MHFA? What is the principle? Iba naman ang kanyang principle. Although some of this may also overlap with PFA, the principle is called ALG. No? So first, you assess the risk of suicide of the individual. So how real is the thought of killing himself? So perhaps you have to prove further, okay, when do you want to do this? Or how will you carry your thoughts perhaps of killing yourself? And the more specific the plan, the more you have to be there for the person until such time that you can refer her to a mental health professional, like a psychiatrist, if she needs medication. Okay? So, second, you have to be there non-judgmentally. Okay? So, some people would simply dismiss, no? Madali lang yan, kaya nyo yan. So, without being sensitive. Okay? So please don't be dismissive when you are with people in need, okay? Because that even add to their problem. Okay, give assurance that medical help will be there. Of course, you have also to give them the information. Where will they get that? Okay, so you have to provide. Remember, be accurate in giving information. Don't give false information, false hope, because you are not helping these people. No? So, dinadagdagan mo lang ang kanilang frustration and disappointment in life. And at the same time, encourage people, if they are compromised, to seek professional help. Okay? If there is none in your center, if they have the opportunity, tell them to please see a psychiatrist, or perhaps see a psychologist, or perhaps talk to a professional so that they can be assisted. Okay? And see to it that they have their support system with them. Okay? Next slide, please. So, how will you, when do you use? Tingnan nyo ang perspective ng PFA, no? So for people who may be experiencing simply loss, grief, for a volunteer, so she may be looking at it as number 6. But for people whose mental health is already compromised, they will be looking at the number as 9 rather than as 6. So you see, so this is the perspective of people who may not have mental health conditions compared to those who are simply affected by the calamity. Okay, next slide, please. So people who need more than PFA, as I have said, okay, so people with serious life-threatening, okay, injuries, for example, so kailangan dalhin yan, okay, sa medical facility right away, okay, people who intend to hurt themselves or people who may hurt other people. No? So galit siya sa mundo. So at andun pa yung kalaban niya. So gusto niyang saktan, inalaban mo. So you have to see to it that they don't harm anyone in the center. Okay? Kasi magbe-breakdown na siya, no? So the level of distress is overwhelming. Okay? Next slide, please. So what are the distress reactions of people in crisis? Okay? So you can see here, some people may be shaking, they may experience headaches, they feel fatigue, they feel no appetite, okay? Others are withdrawn. No, they become numb, they become paralyzed or disoriented. Others feel guilt. No, they will blame themselves. Sana umalis na tayo dito. Sinabi ko na, hindi pa tayo umalis. Narinig natin yung warning. Hindi pa, okay? So, they might blame themselves. Or they will be ashamed, no? That they survive. Bakit ako pa ang namatay? Ay, hindi namatay. Yung magulang ko, katulad yung sa Tacloban, hinahawakan yung magulang niya. No? Sa matagal lang sa gitna sila ng baha, nabitiwan niya ng magulang niya. So she was blaming herself. No? Bakit hindi pa ako namatay? Bakit ang magulang ko pa? So you see? So these things are being experienced by people in crisis. So they can be angry or they can resort to drinking as a result. Next slide, please. So what are the do's and don'ts for PFA providers? So anong gagawin ng mga volunteers? So see to it that you are calm when you talk to the people, okay, who are distressed. Alam nyo nang hyper na sila. Huwag nyo nang dagdagan. Simply listen. Let them ventilate. Don't interrupt. Okay? Huwag mo sabihin, okay lang yan. Wala yan. Kakayanan nyo yan. No? So just let them ventilate. Don't be dismissive. Okay? And then simply ask, even if you know they need basic needs, you just ask them, what is it that you need? Because that will give them the assurance that at least it's coming from them, rather than they feel that it's a dole out, that you are giving it, no, that they cannot help themselves. And don't make promises that you cannot keep. Okay? And also, visit them once in a while to see how they are doing. Okay? Next slide. Okay. Now, how will you communicate? How would you say things? As I have said, no? Try to talk to them in a quiet place where there is less distraction. Be patient and be calm. Respect their privacy, especially if they are telling you confidential things. That is very important not to share it with anybody. Okay? So you have to keep it to yourself. Hindi ito chismis that, aha, ganito pala, may kasama pa pala siyang kabit siya na matay, etc. So, marami pala siyang pera, buti nga sa kanya yan. So, don't add to the situation anymore. Respect the privacy. Keep the story confidential. Next slide, please. Now, what are the things that you have to avoid? Don't pressure them to tell you their story. Ikwento mo nga ano nangyari nang bago pa na dumating ang bagyo. So, because they are not in the proper disposition to tell you their story, their narrative. No? Wala na silang damit, hindi pa nga sila nakaligo, hindi pa sila naka-toothbrush, hindi pa sila nakapapalit, hindi pa makwentuhin mo pa, nadagdagan pa ang kanilang anxiety. No? And don't interrupt or rush them. Okay? Don't make them feel that you will solve their problem for them. Okay? So you are not there. to solve their problem. Okay, so this is very important. Okay, so you have to tell them that it is still their effort that help can start from. No, so don't talk to them about your own troubles because they are not there to listen to your trouble. Okay, they are there to be listened to. Okay, next slide, please. So now let's hear again from another video. Thank you, Mhpss. Okay, maybe we have some problems, technical problems when it comes to the sound. But anyway, I hope you have seen what are the signs. So this is very important for PFA volunteers, what also to look out for. Although this is really the concern of those applying MHFA. Okay, so the warning signs, talking about wanting to die, talking about feeling trapped, talking about the burden of others. Okay, so their families are dependent on them, so they cannot send them money anymore, so they feel helpless and useless. Okay, or they have no sleep anymore, or they have too much sleep and therefore maybe a sign of depression. Okay, so this is very important that MSFA volunteers had to be at the lookout. Next slide, please. Okay, so let's hear if this can be very helpful, how to prevent suicide. Okay, if not, it's okay. Okay, I think we need to discontinue this video. We will not be able to appreciate its content. But if the volunteers may need this, perhaps you can request the link from our secretariat. Next slide, please, Ms. Shane. Okay. So what are the other risk factors that volunteers of PFA and MHFA have to be on guard? No? So please prevent. Okay, especially if the person is already has experienced a previous suicide attempt. No? Sa pagkikwento niya, she told you about her attempt in the past. No? So that is already a red flag. So these are red flags that you have to remember, look, listen, and link. So by just looking and listening, you can already refer these people from the proper MHFA volunteers. No? History of trauma, history of abuse, hopelessness. So these are all red flags. Okay, next slide. Now, so we know that mental pain is may look very less dramatic than physical pain, but actually, it can be long-lasting. As a matter of fact, if it is physical pain, you just have to rest for a while. You sleep, and then the pain, the physical pain, will disappear. Unlike when it is emotional or mental pain, even if it's already 10 years ago, you still carry it with you. That's why some migrant women workers had to go out and work abroad because they carry the pain, the mental pain of not looking at their families suffering back home, and yet they are also suffering in destination countries. Okay, next slide, please. So what do you have to remember, okay, as volunteers? Okay, so please avoid being judgmental, encourage to get help, reassure that there are support system available, and give hope. Okay, next slide. So what are the ethical guidelines that as volunteers you need to remember and you need to avoid? Okay. So one, be honest and trustworthy. Okay. So you are there because you are assisting. Okay. So don't add to the burden of the people suffering. Okay. Respect the person's right to make decisions. Don't decide for the person. Okay. Some volunteers think na by deciding for them, they are helping. No. Actually, we are emasculating them if you decide for them. Because the ability to be resilient, the ability to bounce back will depend on the ability of the person to own his or her decision and make the appropriate judgment. So respect the privacy of the individual and the story. Okay, if ever she told you something that is very confidential. Okay, respect the culture, the age, and the gender. No, sad to say, you are already in an evacuation center, but there are still people who are raped inside the evacuation center, who are abused inside the evacuation center. So it's not safe. No, kaya it's important that you just don't cause harm, but you also prepare, no, and see to it that safety is provided to all. Because in an evacuation center, everything is open. No? So it doesn't mean that just because they are there, no, they are safe. So they are still to be guarded. So what are the things that you need to avoid? Okay, so don't exploit, take advantage of your recipients. No, don't exaggerate what you can do because you may simply be making false promises, and don't give favors. No, okay. So please do remember all this because these are very, very important when you are volunteering. Okay, so you are not simply there physically, but you are also there as a symbol of hope, as a symbol of stability, and as a symbol of support. Next slide, please. Okay, so where do they get help? Okay, so you can perhaps you refer them to the professional, or you can refer them to people they can talk to. Okay, or you can provide them information that will be very helpful, no? Like addresses of relatives, or where to get loads so that they can contact their friends, or connect relatives who are lost because of the evacuation center is far from each other. One relative is brought to one center, the other one is to another. So by providing assistance, you also give them immediate connection with one another. Okay, next slide. Again, so let's see. Okay, after listening to, you check your answers again. Okay, because we will give you the answers after this. Okay, so review, okay, your answers. So after looking at your early answer, now check again after listening to what we talk about. So try to change if you think you need to change your answer, because this is exactly based on what we talk about. Okay, so if you have reviewed, okay, let's go to the next slide to get the answer. Okay, now, so this is the answer of the 15 questions. Now, so how did you fare? Because if you did fare, then you understood what it was. Okay, Miss Jane, can you please give me feedback on the chat box? Okay, if there are some questions, perhaps. Okay, so next slide, please. So these are the references of the talk this afternoon. Thank you for listening. I hope this was very helpful, especially for our OWA mental health attachés in foreign countries, and also those DSWD social workers in our home country who are faced with challenges like disasters, typhoons, etc. Thank you very much.
Thank you very much, Dr. Je, for that comprehensive presentation. And now let's listen to Dr. Paz for her presentation. Dr. Paz, please.
Okay, thank you, Ms. Mel. So, thank you, Doc Jerry, for that presentation. So again, from my part, it's really more on our task as volunteers. Okay, our task as volunteers eventually when we will be helping, no, our migrant workers as they come back or in their destination countries. But first, yung sinabi nga kanina, we have to be able to manage our stressors, okay? So that when we are able to help them, console them, no, give them psychological first aid, we are not stressed out, no? And maybe things that we also learn for this afternoon, we can apply to ourselves, then we can also teach, no, our co-workers as well. Okay, so maybe you could also help me here. Shane, where are you at this point in time in terms of feelings? No, are you one? I'm quite happy. I'm okay. I do not know where I am right now. I'm neutral. Or I'm so disappointed. I'm sad. Especially now, no, because sometimes this would change. Maybe last month you were number 1, but maybe now you're number 3. No, so maybe I also want to see the feel of the group. If Shane can help me here, you can just put 1, 2, or 3. Yeah, can I see the responses of our group so that malaman din natin kung gaano sila ka-stress ngayon. Kasi this is a good assessment also on your part, no? You're being honest about where you are at this point in time, because it's also very important for us to know and to assess, because this will give us also a clue, no, how ready we are to be of help to others. Anong majority, Shane?
1 po.
Okay, so that's good. Okay, so 1 ang majority. So more or less, you know how to manage your stress, you're ready, which is also very important, no? And you're ready in yourself at this point in time. Okay, thank you. Thank you for that. Okay, so in terms of what stresses you nowadays, no? Give your top 3. Anong nakaka-stress sa inyo ngayon? Awareness like this is very important. Yung sinabi nga kanina, every now and then we have to reflect, we have to think, we have to pause, no, to see where we are at this point in time, especially when we prep ourselves up to be helping people who are in a more difficult circumstance than where we are at this point in time. Can I have a response, Shane?
Ma'am, no response pa po.
Okay, just please. Anong stressor ninyo ngayon? Is it family?
Ayan po,
Is it
meron
money?
na po.
Okay, sige.
Hindi
Thank
po
you.
makapunta sa mall.
Okay.
Restriction.
Okay, the lockdown causes you stress. Ano pa?
Work responsibility, travel restrictions. COVID-19 po. Urgent task. Deadlines, health, work, current crisis situation, work, school, health, hindi ako makakauwi, overwhelming work, finances, being displaced, responsible for my group, hindi makasama family. Yun po.
Okay. So, it's very important also that we mention, that we also know that we are very specific with our stressors so that we know how to manage these stressors. Okay, so I'll give you some of the common stressors that we have nowadays, and maybe some of this you can classify under what do you call this, under certain classifications of where you are at this point in time. So it was mentioned kanina, maybe part of it really is also relationships, no? Family, you're worried, hindi ka makauwi, di ba? These things, no? And definitely now, no? This was also mentioned, yung emotional stress natin because we're always worried, and that's number one. That's really a stressor, no? Physical, no? Sexual, financial abuse that we have nowadays, especially because of COVID-19, talagang tumataas ang sexual abuse ngayon, domestic abuse, no? Sometimes also some controlling behaviors in a relationship. And again, this has been exacerbated because of the pandemic, no? So that's one, we have that stress. And certainly when we will go through the training later on about some PFA methods, no, in terms of when we will be talking to some of our some of the victims, no, some of the migrant workers, you would see that one stressor that they may have would be relationship stressor. Okay, let's move on. Finances, na mentioned yan kanina, no? The pandemic has altered every aspect of our lives, no, including our money problems. Problema na nga yung pera, umulit pa, di ba? Mas grabe pa ngayon, no? And again, the filing of unemployment, it was also mentioned, coming back home, whereby you had work abroad, but now when you come back, you have again to search for work, kung may work, no? Those who are in small businesses are really also struggling, no? So, you would feel financial stress when you feel anxiety or worry over financial problems, no? And it can impact many different aspects of your health, from the way you feel physically to the way you interact with loved ones. So maybe again, you feel so down, you worry a lot, and you can be more angry now. And this could also be, it could have the domino effect to your family members, no? Because of your financial problem. And this is very important, yung sinabi din kanina, no? Mental health, no? We worry so much, no? We cannot sleep at night, no? Sometimes sinasabi, nabubuwang na ata ako. Am I getting crazy? I'm so overwhelmed with all these things. Not only mental health, but we're also talking about physical health, no? We have to remember so many things when we go out, no? Did I bring my face mask? Do I have to take my temperature? Even when you go to the mall, di ba? I have to wash my hands every now and then, leave all these things. So there are so many things for us to remember, no? That it also causes us stress. And even the healthcare, yung sinabi nga, walang insurance, how much will it cost you, no? To be in the hospital? The medications are so expensive, lalo na kung walang insurance, or even if you have the insurance, it will take quite some time. May problema pa rin ang PhilHealth ngayon. So this also would cause you stress. It was mentioned, work, no? Part of it is your exposure to the virus, no? Because perhaps you really also need to work. So sometimes, no, bahala na, okay? You're also part of it while you're working, you're thinking about how safe your families are, your family would be, no? Access to certain tools. Maybe we were also stressed out a while ago, hindi tayo makakonect with the webinar, and we think we need to attend the training because we want to volunteer. So maybe that was also part of your work-related stress. Sinabi nga rin kanina, sabay-sabay ang trabaho, di ba? You have to learn new communication tools. You have to learn to deal with technical difficulties. Okay? Ang hirap din yung adjusting to your workspace. Parang your work has invaded also your home. Diba? Ang daming ganun nga. Like, this is my home, my private space where I can relax. But now, work has moved in with me. So how can I divide these tasks? Diba? So that even if my work is at home with me now, I'm still able, no, to manage whatever stress I may have, okay? So part of it also is the uncertainty, no, of the future of your work, no? Kung mag-lockdown uli, certainly no work, no pay. Okay, and when you look at this also, maybe certain feelings, no, about your work. Am I contributing enough? Is it enough? No. How about my other coworkers? So these are all things, no, that would be a stressor under work, no. Sinabi din kanina, no, safety. So even when we're safe now also from the storm, ano yung safety natin in the evacuation places, no? Social distancing. Then again, are we safe from the virus? Because you cannot have this when you are in the evacuation place, no? Lahat nawalan ng bahay. You have to go back, okay? So that's part of it, no? So again, uncertainty. You have that uncertainty of safety. Am I safe enough? Diba? Habang wala pa yung vaccine, okay? We're not yet sure. There are a lot of studies still being said about how the virus would work within us, and there are still other measures, no, other side effects of this virus. So sometimes even safety is uncertain for us. That's also a stressor, no, and also some obstacles to safety, no. So we know that the vaccine might be there, but when will it be available to us? Okay, so a lot of these things, personal safety is a stressor for us, no? Even as we travel again, coming back here, no? Or maybe trying to help migrant workers in our own country of destination, we're again trying to look into, no, some of these stressors that might also, no, impact on our safety. So when we look at again the effects of these stressors, we have to see it from that perspective. It's very important for us to understand stress so that you know how it works within you. And when you know how it works within you, you will be able to manage it. And when you manage it, then you are able also to share this, no, to people who would come to you for help, because certainly, no, they come to you because they're also stressed out. Part of that stress might be a loss, a grief, no? Because stress could also be the situational stress. The situation where they are now, is it the pandemic? Is it that storm? Okay? Or it could be an event stress, no? Loss of a job, nagkasakit yung anak nila, okay? Walang balita sa Pilipinas, okay? That's the event because of the storm. Or it could also be a stress in anticipation of an event, no? So when I go back, ano mangyayari sa akin? Diba? So, hindi pa nangyayari, you're already anticipating the stress. Now, when you look at these things, no, a certain kind of stress, no, also motivates us, also pushes us to do better. So this is what Doc Celje, Hans Celje was talking about, no? Some stress could be positive. It's a pleasant form of stress caused by a desirable stimuli, perhaps, no? Because it enhances us to do better. So perhaps when we will be doing volunteer work and somebody might come to us and say, "Naku ma'am, naku sir, thank you so much for what you've told me. Nabuhayan ako ng loob," no? So maybe that's a positive stress for you, no? You were stressed out in helping, but that was something positive, no? And it pushes you, it motivates you to say, "Ay nako, magte-training pa ako, I will be more, what do you call this, more motivated to help others because I see, no? I see the rewards, no? And that certain stress that I should do better because I'm helping more, no, moves you to do better and to be a better person to help others, no? But again, the stress could also be negative, no? When it causes mental agitation, hindi ka makatulog, di ba? You're always worried. Yung problema dito, if it's too long already, like a prolonged exposure to this stress, will have harmful effects on the individuals, no? So harmful effects might be a heavy workload, financial trouble, and it could lead also to disruption of your mental health. Yung sinasabi na we want to avoid, no? Na we don't go into that kind of dilemma that we have problems already mentally and we cannot function very well, no? So we want to avoid this negative stress. So as we move on, we see, no, that benefits of stress, no, it's good in a way, no, at a certain level. It makes us more productive. It makes us say that I have to do better. What are the other things that I can do so you can be more creative, no? It pushes you, energizes you, no? Maybe I should do better this time. There are other ways to do it. I know better now. And it motivates you, no? It motivates you to be a better person, to help others, to find ways, no? To perhaps do more, volunteer more, help others more, okay? So when we look at this, no? It can also give us physical problems in a way, no? When we talk about stress that is too much, no? So sometimes it's very important also for us to realize, no, that stresses might come in the form of headache, right? Loss of appetite, okay, sweating. This might be some concerns that we might feel. So maybe we try also to assess ourselves. Am I having more palpitations now at this point in time? Do I have more, problems with my tummy? Usually gastrointestinal yan, no? Kailan pa nag-umpisa ito? Do I feel more tired, more fatigued at this point in time as compared before? No? Nag-improve na ba o grumabe na ba? So these are very important aspects for us to take note of because this would also be signs, no, of whatever physical stress you may be feeling, no? Or it could also be a psychological stress, no? Am I more anxious now? Am I more bored, depressed, tense, irritated? Okay? And then you also have to see, gano'ng katagal na to? Kailan ito nag-start? Was it during the pandemic? Was it during this time na sunod-sunod yung workload? So very important also that you're able to look, no, into kailan nangyari ito so that you can really have an assessment, no? And the better, the more knowledge you have, no, about the effect of stress on you, the better it will be for you to manage also your stress. And these are questions that you may also ask eventually your counselee, your clients later. Okay? So sleep is also one of those concerns. That's number one din talaga. Sleep disorders because you're always worrying, no? Maybe taking some sleeping pills, no? Because it would help you sleep. There are some that could be natural, that would be okay, but other things whereby you need prescriptive drugs already, no, would also be a sure sign of stress. Although you would need it for the meantime, no, but eventually we have to, in a way, handle our stress in the natural way because stress are already part of life. So knowing it and understanding it is very important. People can also become violent and they could attack people. So ito na yung sinasabi na it already became a mental health issue, no? Because hindi agapan yung stress, no? It was chronic, it was prolonged, no? So again, in terms of the tolerance level of the stress, yung kaya ng tao, no, hindi na nakayanan because no early intervention was given, no? So this external, when we look into this, no, we know, no, it's also good, no, that the body has its way, no, of looking into stress. At hindi yung bigla na lang, stress will come. So the stress has been there, and we have different stages, no, of this stress. You see, at least we know na hindi bigla dumataan yung stress, no? There are mga warning signs that we also have to be aware of, and this we should not take for granted, no? So, alarm stage would be when there are external stressors already, no? Yung sinasabi na nga, palpitations, blood pressure, rate of respiration, no? Nanenervyos na tayo. And it's very common, again, for our body to resist this, to say no, normal lang yan, no? It always happens anyway. That's why you have to assess. Is it already normal? Hindi ka naman ganyan 2 years ago, a year ago, okay? Does it come with age or is it also because of the situation? So what are some of the things that I have to do now, no? But sa resistance stage, you're still in denial. You're still saying, no, kaya ko pa to, di ba? Although the alarm stage has already been telling you. What we don't want to happen eventually is that we reach the exhaustion stage. Kaya nga nakita mo, that's a red flag, no? Kung pwede, we don't reach this stage, okay? Because when we reach this stage, we are not able to help people. Now, we will not be able to volunteer ourselves because we will need that help. No? So we don't want to reach the stage because we know that there are a lot of people who would be needing our help. So yung sinabi nga, we have to take care of ourselves, and one of that is we acknowledge whatever stress we have so that we will be able to manage it, no? Because we don't want to be depleted, we don't want to be on the verge of breakdown, okay? And usually you are exhausted already when you are not able to perform well. Sinabi nga kanina, di ba? When you are mentally healthy, physically healthy, you're able to what do you call this, manage, no? Normal stresses that come your way. Pero dito, any normal stress, ano ka na eh? You already react immediately, di ba? You are already in the extreme side. That's why a depression might happen, a breakdown, or a burnout. And then what you will need now is really more of the mental health, no? And not already the psychosocial first aid, no? That could have been given to you if it was managed early, no? That's why I always say this, no, manage your stress before it manages you, no? Preventive measure, that's always the shout out, no, of counselors, psychologists. Preventive measure is the best, no? Early intervention is the best because it's easier to manage at this point in time kesa yung naging grabe na, no? So when we look and we look into how we are able to manage our stress, no? This would be looking at it from the coping aspect, no? Okay? We have to find a new way to look at the problem. We have to distract ourselves from it, no? And again, it's not a one-time action, no? It's an ongoing set of responses. That's why very important, again, always, no, to understand your stress, because some people are just, it's a personality thing. Some people are just more worried than others. Others are like, okay, cool lang. Pero some people are really like, they worry so much. And you really also have to like train yourself, train your mind, okay? It's not a one-time action, no, whereby you learn to relax, no? Just go to the bookstore or magtignan lang, you just go through the web and see how many topics are there on how to deal with stress. Napakadaming libro yan, no? Napakadaming strategies na binibigay. So it just goes to show, no, that people, they may know it here, what to do, pero hirap sila really, no, to put it into action. That's why, like I said, it's really a process that we have to imbibe on a daily basis. Okay? And you have to look at it from that aspect of coping with something that's emotional, because part of it is, part of the stress is two ways of coping. It could be the emotional focused concern, no? When you look at the problem, no, from the emotional aspect, no? So when you look into these things, it's also asking for support, no? Sometimes, again, stress would be associated with something that's negative, and any form of change, whether it's for the good or it's for the bad, it's still a form of stress. And two types of coping there. You could focus on it from looking at it from the problem. Ito na yung problema. How will I go about it? What are the things that I have to do to solve this problem? So it's the problem-focused coping. And another, sorry, where did I go here? I'm sorry for that. I have to check. Okay. Pati, even my eyesight, no, has a problem now. And problem focus, like I mentioned, no, looking at the problem, what are the steps? And we also have the emotion-focused coping. Emotion-focused, this is one that is very common now, especially when you do not have control of the situation. So you try to change your negative emotions to positive emotions, because there's nothing you can do at this point in time, no? It cannot be a problem because you had no control of the problem. It has happened. So what do you do emotionally, okay, so that you can move on? And a lot of things that are going on nowadays because of the pandemic are really on the emotion-focused problem. So again, are you aware of your stress? Do you know how to manage your stress? So this is very important for us, no? So we were talking about you enhancing your awareness, no? You have to believe really that stress is bad for your health, no? Mental health and physical health, okay? And you should also perceive this, no? The seriousness of the condition. The seriousness of the condition means to say that if it's prolonged, no, you may have a breakdown. So the earlier the intervention, the better it will be for you. Okay, and you should also believe, no, that some of the exercises that we will be doing, that you will be doing on your own, no, will benefit you, no, and hopefully, no, will make you take action, no, so that whenever stress may come your way, it might be an event stress, an anticipatory stress, a situational stress, no, you're able to cope with this. Because again, every day we face certain stress. And what is important there is we're able to navigate, no? We're able to manage, no, the stressors that come our way. Number one dyan, relax, no? How many books are there again in the bookstore that talks about how to relax, no? What I really miss also now are all the health clinics, no? Whereby at the end of the week, we are able to relax because of a massage, because of good music, no? Because certainly we are bombarded with different types of stress on a daily basis. So very important for us really to understand, befriend the stress so that we're able, no, to manage it. So again, relaxation, letting go, loosening up, no? Andyan na talaga yan eh. So we'll just accept it, no? Letting go of whatever things that are not important. Sabi nga kanina, no, there are things that are not within our control, so we let that go. And sleep is number one. There are a lot of studies nowadays because of the pandemic and the storm. We have nightmares, we cannot sleep, it's so hard to go to sleep. Pero sleep is very important to put our mind at rest, okay? To restore our energy, to conserve our energy, and it's very important for our own well-being. It's how will I say? It's also good. At Miriam, they also decided, no, to have a suspension of classes for this week because they realized, no, that we have to pause again, di ba? We have to restore the energy before we can face again the academic load. So at this point in time, because after that storm and also stress of distance learning, no, this is also a welcome respite, no, for students as well and for teachers, no, whereby they have to come together again, no. Energies has to be again reserved, no, so that they could face again the day after, okay? Because again, working long hours is a barrier to relaxation. If we worry too much, if we have the unchecked imagination, this causes, no, these are obstacles for relaxation. It's not easy to do. It's not easy to do, no, when you free yourself from worry and when you and when you talk to people who are very worried, it's not also a good thing to say free yourself from worry because it just doesn't it's not the right way of saying things. But as later on, no, and you try it also yourself, it's very important for you to practice, no, to free yourself from worry, no. You check, no, how significant is this worry? Should I worry about this o pwede na lang hindi? Maybe if I have 10 worries that I have now, can I just make it 5? Can I just make it 3? So very important also that you reflect, talk to yourself, no? Because it's so hard if you try to tackle all your worries, it will not work for you. Kaya nga sinasabi ko, as we go through the workshop, practice it yourself and see what would work best for you. Because these are the things that you cannot also share to your clients if you have not practiced it, and if you do not also believe, no, that it works. Again, thinking, no, your thoughts, not the world, cause your stress, no. So it's again a mindset, no, training your thoughts, no. What should I think of? Should I worry about it? Is it worth worrying? Or maybe I can worry about it next month na lang. Total, hindi pa naman nangyayari ngayon. So again, there's so much that you would be bombarded with. That's why it's very important for us, again, to control this as well, no? Thought control is very important. Your attitude towards stress, no? Your attitude toward what is happening right now, no? This is why in positive psychology, they try to see, yeah, it's negative, but I want to see, no, the positive side. Because if I worry too much, it will not happen. That's why, what has happened, no? There was nothing that we could do about the pandemic. Anong naging uso? We looked at the plants, no? We looked at Mother Nature, and it gives us happiness. You know, I'm so happy when I see a little leaf sprout from my plants, no, every morning, so that I get already that positive, what do you call this? Positive feelings, no? Like, I just stare at the plant and I say, oh, it's growing na. So it gives us hope. Kaya siguro ang daming nagkaplantita, nagkaplantito, taking care of the environment. Because for them, no, it was like, there's hope, no? So much can be done, no? So it has helped them cope with the worry, with the stress, okay? And looking at it from the positive aspect, okay? It gives you hope, no? A mental vacation is very important, no? Yung sinabi nga kanina, I want to travel, I cannot travel right now, so maybe look at your pictures, you have your phone, no? Take that mental vacation, you try to visualize how it was before so that you get all these positive feelings, no? That's the power of the mind, no? Na parang, nakapagbakasyon din ako, kahit 5 minutes lang in a day, if it gives you that positive energy, no? It will really remove a lot of stress, no? Or also, maybe you have your own litany, your own positive line. This one is my favorite from Gone with the Wind, no? Tomorrow is yet another day, okay? Tomorrow it will be better. Actually, we're all looking out na towards 2021, di ba? Yung mga iba gusto nang mag-celebrate ng New Year to that 2021 na. We're all looking forward, no? That this too shall pass, okay? And affirmations, that's very important. We also have to affirm ourselves, no? It gives us hope, no? Say, kaya ko yan, I will manage it, no? There were things that I have undergone before, no? I was able to manage it, so perhaps I'll be able to manage this now. Remember, even if other people tell you kaya mo, if you yourself do not believe na kaya mo, hindi yan mangyayari. So very important, you are your own best friend, okay? When you affirm yourself about things that you have to do. When you're under stress also, always take a pause. What did I say? When you take a pause, very important for you to count 1 to 10, no? Kasi emotions can come so rapidly, eh. And sometimes we can be very impulsive with emotions, no? So it's very important that we count 1 to 10 so that if ever we are angry or stressed out, when we count 1 to 10, medyo no? Medyo yung anger na it was so intense, no? It could have been lessened already because of you being able to count 1 to 10 and taking a pause. There are a lot of things now that all work is from the internet, no? And then we just look at the screen. Maybe when we are even doing counseling, it's always on the screen. Nakaka-stress din sa eyes, no? It makes the eyes tired. So very important also for you to look away from the screen, maybe at least 20 feet, no? Look at something nice, no? Close your eyes before going back to the screen, so that again, muscle tension, eye muscles, no, would also be relaxed, no? There are a lot of eye problems now because of screen time. So again, if you're also under stress, you're angry, negative emotion, you're with your family, with friends, with colleagues, instead of saying something, no, that you might regret later on, maybe just excuse yourself, leave the stressful situation, go for a walk, o hindi pwede, maybe try to punch the walls, not really punch the wall, but the air, just to release all that energy, okay? So that when it's released, you can go back and you're more relaxed. Kaya ang dami rin ngayon, no? They're doing exercises every now and then to release tension inside. Just try also to practice breathing exercises. This is very good, no? Use the 4-7-8 breathing technique, no? Close your mouth and inhale through your nose to a silent count of 4. So hold your breath again for a silent count of 7. Then you exhale completely through your mouth to a silent count of 8, no? Repeat the cycle 3 or more times for a total of 4 breaths. This is very effective breathing exercises, no? Because the science here is that you bring oxygen, no, into your system, blood flow, no? It goes to the brain. Oxygen helps, no, in relaxing you, no? So maybe before you face a client, no, maybe dalawa muna kayo, you mag-ano muna tayo, breathing exercises, no? Let's do our breathing exercise before you start the conversation, no? This will help very well, no? Yeah, yell or cry, di ba? It's not only for children, no? But it's also for us. But maybe again, when we yell or cry, di ba, mahirap naman, baka sabihin, ano na tayo, nabubuwang na tayo when we yell in front of all the people, no? So maybe in a private room, or you know what I do? I get a pillow, no? I yell sa may pillow so that nobody hears, no? But that yelling, that motion of shouting, no, releases, no, emotional release, no, and it helps. You see how relaxed we are after a good cry, no? So that's also very important, no, for us to do. So these are things that you can practice, no? Laughter is the best medicine. Reader's Digest pa yan noon, no? Laugh out loud, no? What does a laugh do? It relieves physical tension and stress, leaving your muscles relaxed for up to 45 minutes later. Okay? It boosts the immune system, very important now that we have a strong immune system because of COVID, no? It releases endorphins, which is the body's natural painkiller. It's the feel-good chemicals, no? It improves the function of our blood vessels, no? Good for the heart. It lightens an anger's heavy load. And see, studies have shown that even a fake laughing, no? A fake laugh can elevate your mood. So just fake your laugh kasi that exercise itself brings in the oxygen, no? So again, these are things that we can do, okay? Stretching, very important, no? Even while we're at our desk right now, while Doc Jay was talking a while ago, I was also stretching, no ba? It's very important that you get to stretch, no, to relax certain muscles, no? Maybe sa internet, you try to read on what are the tension points, then you can also do your own, what do you call this, massage, no? Or maybe if you are with a support group, you help one another and you can have your own, ano, di ba? Where to massage, target points, etc. No, these are things also that can help us, okay? So these are things we can do for ourselves and for others, no? Listen to music. Dami na ngayon good music. It could be inspiring music, or it could also be music from nature, no? The chirping of the birds, the waves, no? What do you call this? The trees, bamboo trees swaying. This is very good, no? This is a picture of my plants at home, no? So I stare at them in the morning and see, may bago na naman kayang leaf na what do you call this, na buhay, no? So these are the things that keeps me relaxed at this point in time instead of driving through traffic, no? Because I also work from home. So photos, no? Gaze at a photo of a loved one, a family. It is in your desk or a wallet if you're stressed out, no? It's very important to look at it because it gives you happiness, no? It gives you that endorphins or that dopamine, no? When you look at a picture of someone that you love. That's very important. Or you keep your own, your happy basket, your happy box, no? I have a bag, no? A box where I put happy things. I have my lavender oil. I have my, ano ba to? White flower. Di ba? If you're under stress, you massage it, no? I have letters of appreciation, no? I have happy things. So that when I'm so stressed out that it's all negative, I have to open that box to remind me that, hey, you're okay, no? It's just one of those days, no? But look, no? Many people love you, many people appreciate you, you're doing well. So that's very important, no? And part of stress management as well, no? It's not only for ourselves, no? But we're able to bring happiness to others. Sometimes that's how you manage your stress, no? Give someone a compliment, appreciate them. Share a joke, find humor sometimes in the most depressing aspect, no? But maybe there's something that's good there. There's something that's happy about it, no? You smile at someone. We're kinder to others now. I see this, no? We volunteer more. We help our neighbors more because perhaps we all have this common humanity that we're all under stress right now, no? Whether you're rich or poor, whether you're my neighbor or not, we're all feeling that stress, okay? And it also, studies would also show, no? That our body stress response has benefits for social bonding. The more stressed we are, the more we cling to people. Okay, kaya ang hirap na ngayon pandemic, we're stressed but we cannot go with people. It's good we have virtual meetings, di ba? It's good we talk online, di ba? We can say hi to one another without the physical, what do you call this? The physical connection, because now more than ever, we need people, okay? Because when stress levels rise, our bodies release a neurohormone, oxytocin, which signals a need for social connection and social bonding, okay? So you will really expect people to come to you, to talk to you, to share with you their concerns, okay? And this will also be beneficial for you as a volunteer, because you will also, this will also affirm you as a person. It gives you also a good feel that you are able to help. So even in the midst of social distancing, it is essential for us to stay connected with others, okay? Very important for us that we are deliberate and intentional about the use also of social media, because sometimes we also see the bad news, no? We also see people being bad to another person, and we realize, nangyayari ba ito? But it's also happening. So maybe we also have to be deliberate on what social media to use, no? What news to see, okay? And we have to find ways, no, to be able to connect with others. So we look into positive emotions, okay? We try to bring out that positive emotion more than the negative emotion, because positive emotions would decrease feelings of anxiety. It would speed up recovery from illness. It could also prevent illness. It allows us to better deal with stressful situations, no? People also would have higher incomes and get more praise at work because of a positive emotion. They are viewed as more likable, competent, and intelligent. They can experience more creativity of how things would work. They can be more efficient when they make decisions. They can live longer, and they can be more persistent, no? Especially when they have to do tasks, no? So again, that's very important, especially when we are looking into stress levels that we have nowadays, okay? So with all of this, it's very important for us, no, to remain positive, to have the heart, okay, to look at the sunshine, okay, to be thankful, no, of the environment that we are in. So this was also made by a student of mine, no, during the lockdown, no. She's an artist, and part of what she did was yung art niya, ginawa din niyang face mask. She also donated, no, or proceeds of the sales was donated to her parish, no. So these are things really that we can do in a way, no, to alleviate us of our stressors. Thank you, and maybe we are open now for questions.
Thank you very much, Dr. Paz. Yeah, but before the open forum, we would like to have our group cloud chat. So may we request everyone to please put on their video and have a group chat before the open forum. Thank you. Shane, can you please do the group chat?
Siguro ni Shane kami controlling the video. She controls our video.
Yeah.
Miss Mel.
Yeah, sige. Please show the Shane.
Yeah.
Yeah.
Okay.
To everyone, yeah. Put everyone on video, please.
Yes po. Okay po. Let's take a picture po. 1, 2, 3, smile. Isa pa po. 1. Wait lang po. 1, 2, 3. Smile. One more pa po. Medyo marami po tayong participants ngayon. 1, 2, 3. Smile. Yeah.
Nakunan na ba lahat? Baka meron din nasama, Shane.
Yung iba po naka-turn off po yung camera. Pwede pong pa-request na i-open po yung camera po nila. Yes po. Yeah. Yeah, okay po. Okay po. Okay, 1, 2, 3. Smile. Okay. Thank you so much po.
Sige. So thank you very much, Lance. So now, before we have the open forum, I would like to introduce our facilitator for this afternoon for the open forum, Lance Velasco. Lance has been a long-time volunteer supporter of Dawn since 2007. He assists in developing programs for women migrant returnees and members of their families. He also assists SICHI, Dawn's Alternative Livelihood Program for Women, and Dawn's Multipurpose Cooperative, where he is now a member of the board. Lance has been the coordinator of the Philippine Migrants' Rights Watch from 2007 to 2008, and from 2016 to the present. He develops programs for awareness of rights of OFWs, provides inputs for policy and legislations pertaining to the welfare of OFWs and members of their families. And he's also the editor of the PMRW publications. Lance is the president for Luzon of the Parliament of Youth Leaders from 2013 to the present. He is also the director for Manila projects of the Philippine-Australian Sports and Culture from 2019 to present. Lance is an AB Political Science graduate at the University of Santo Tomas. So now, Lance, can we please have our open forum? Thank you.
Thank you, Ma'am Mel, for that. Kind remarks. So anyway, thank you also for our speakers, Dr. and Dr. Paz, for that very insightful and very comprehensive information on how to protect and promote the welfare of our migrants, especially those who are in stress. Especially now, we are at times of emergencies. This is extraordinary times at that, knowing that first we had COVID, and now we also have all these typhoons and all other natural disasters that are happening, which is really taking a lot of its toll among our migrants and also members of our families. So to give maybe a summary of what happened, I would like to talk of what Dr. said. I had some notes of what he said, where he also provided insights that debunk typical mental health myths. Because sometimes we have issues that those who are mentally challenged might be violent, but it's not the case. So at least we learned something about that. Then also, mental health is also considered having 8 dimensions. Like sinabi nga, it's like a wheel that has to have all these other aspects into it. And it's also known as state of well-being or wellness. That's the other term for mental health. It's wellness. And also we know that mental health also needs psychosocial assistance as well. And it was also discussed there are two factors of providing first aid, which is psychological first aid and mental health first aid. And there's also the need that what I've learned is that we need to be sensitive at all times, which is very essential if we have to talk to people who are in distress. Because sometimes we try to extend ourselves too much to the point that sometimes we are irrelevant. Sometimes yung sinabi nga ni Doc Jen na, we'll pray for you, we'll help you, but sometimes as sasabihin ng distressed person, prayers are okay, but we need cash. So sometimes that might be the issue, di ba? That's kaya instead of doing more help, you're doing more harm. So at least thank you very much for that insight. At the same time, yun nga, sometimes we also need to know the importance of mental health first aid because sometimes there's a need that they may have suicide tendencies or other tendencies that might need another level of help. So those are the things you have to consider. And kay Dr. Paz naman yung important yung stress. What are the things that causes stress? Especially as mga frontliners who are gonna help or counsel to others. Ang issue ngayon dito is sometimes we get all the stress from listening, di ba? Listening to the problems of others sometimes also cause us stress. Kaya minsan meron issue nga yung mga doctors sa mental hospital. Sila rin yung nagiging patient din sa hospital because sometimes they have this tendency not to cope. And I think this is very important that we learn how to cope from this issue. Especially ngayon, ang issue na ngayon ng mga migrants kaya kapag bumabalik is the financial stress sometimes for most of them. So we have to look into it and how to find a way to get rid of or minimize the stress so that we can also, aside from we help others, we also help ourselves. So that's, I think, one very important thing that we have to look into. Even the point that you have to look into laughing or all the stuff. So anyway, as we're having this open forum, I would like to request people to either raise their hands or ask questions on or put it on chat if you have any questions or if you have any other, or if you like to be called your attention, you just raise your hand. There's a raise hand portion on the Zoom so that you can be acknowledged for your questions. Let's see first if there are any questions here. So while they're still waiting for the questions, I have one question in mind.
Hello po, how can I become a volunteer?
Ito, meron sa ritong tanong. Let me check the chat. Okay, meron na dito. Okay. This one is from Miss Jasmine Mabalot. Hello po, how can I become a volunteer? Sir and ma'am, I mean, what do you mean by volunteer?
Okay. Yeah, perhaps are you referring to the area where you are close to the nearest affected place, or even LGUs, no? Or there are NGOs who may be needing people like you, and you can register, okay, and offer your services, no? So either it can be with LGUs closest to your area, or with Red Cross, or with the NGOs. Okay, so or if you are a professional like PAP, we are psychologists. We also have Mhpss group. So they assign people in the most affected area, so where you live. No? So that can be the case too. No? So yes, that's really very true. We need all hands, okay, on board, especially at this time.
Thank you very much. It's really important that we need people to really help. It's a parang teamwork. Kasi
Yes.
sometimes it's very overwhelming yung mga issues ngayon. It would really overwhelm our people who would be providing this assistance. May we call on Sir Lito because he might have some comments? Sir, let's see. I think I will have to call him. Let's Sir Lito? Yes, Sir Lito.
Hi, good afternoon. I'm having two Zoom meeting. One is with our German employer, who are actually based in Switzerland, and the same discussion stress. Mental health also are affecting us as recruiters and the employers there and our applicants. So what I would like to contribute is what we have been observing in our office from our applicants and from those workers or nurses, engineers, and other skills that we have already been selected or selected by employers, but until now cannot leave or unable to leave. So, ano yung kalimitan na iniisip, concern ng mga aplikante? Mayroon pa hubang job orders? Gusto kong mag-apply eh. Pwede na po ba yung Saudi Arabia? Meron na po ba yung project nyo sa North Sea and so on and so forth? And ang sagot namin ay wala pa. We are waiting for instruction from our employer. So, doon sa sagot na yon, dalawa yung impact kagad sa mental health or worries mo eh. Aplikante na uncertain. Kami rin, uncertain din yung sagot namin. Yun na mga napili na, kailan po kami makakaalis, sir? Eh, noong pa kaming February, January, napili na po kami. Bakit wala pa kayong order sa amin na mag-process? So, ang sagot namin, hinihintay po namin yung instruction ng employer kasi wala pa silang go-ahead na kayo'y paalisin. Kaya lang ina-assure nila na kukuhain din po kayo. Kaya lang hindi pa nila, nag-a-adjust pa sila based sa tuntunin din sa bansa nila on the numbers that they are going to allow based on the situation na COVID risk din kasi tayong sa Pilipinas eh. So, ganun, no? And then, ito naman yung mga hanay ng mga paalis, napili, stranded na mga workers. And we are referring to nurses, no? And other healthcare professionals. Sabi na, sir, paano yan? Bakit hindi pa kami nakakaalis? Na-meet naman namin yung perfected contract namin as of August 31. Nakapirma na kami nung February. Nakapirma na kami nung March. Bakit hindi nyo pa kami paalis? Ang problema naman namin, hindi pa namin ma-process yung papeles nyo sa POA kasi unang-una, ang bagal ng POA. Number one. Number two, yung mga job, yung mga accreditation, yung approval ng employers nyo sa POA na nag-expire during the pandemic, ay nilalakad pa namin ma-approve. Ngayon, bakit hindi pa ma-approve, sir? Ang tagal nyo nang sinasabing na-approve na yan o inilalakad nyo na. Kasi ang ginagawa ng POA, ina-approve naman nila accreditation. Kaya lang lahat ng bakante para sa healthcare professionals, kunwari, yung isang employer, mayroong naiwan na, mayroong pang 100 na nurses na hindi pa napilapan as of April na mag-expire yung accreditation niya. Mayroong 8 na X-ray technician, mayroong ganito na category. Nung pina-accredit namin sa POA, in-approve naman ng POA yung accreditation. Kaya lang ziniro lahat yung job order para sa healthcare professional. Kasi sabi ng POA, ban yan eh. Hindi nyo naman mapapaalis. Bakit kailangan ilagay namin yan ng mga category na yan? Then, nagbago sila ng konteksto. Sige, maaaring approvean namin yan. Kailan kumuha kayo ng verification at permiso sa POLO, sa Philippine Labor Office. Dapat yung mga employer nyo ay magsabi sa gobyerno natin sa POLO na kailangan pa nila yung workers nila. Sabi na ng employer sa amin, may email na. Ipadala nyo na eh. So these are incoherent policies that we are observing now with our government. We need jobs. 17 million lost your job in the Philippines. Here comes nurses with job, with salaries not less than $1,200. But our government is not willing to process or having different way of understanding the policy that so far we have adopted. The policy is very clear. What they have mentioned is that there is a ban of deployment for 14 categories. But there's no ban for continuing to recruit these workers. There's no ban to continue to fill up available vacancies such that when the government changes its policy, then it will be faster for these workers and give promise and hope for these nurses. 65% of them are ex-overseas. They are not employed. Umuwi lang sila para lumipat ng employer. Nagkataon lang na nung matapos yung kontrata nila, nag-decide sila na lilipat ako kasi mas malalaki ang sweldo doon sa isang hospital na yon. Happens to be one of our clients. Or, dahil nandun sila, hindi na sila ni-renew dahil naghirap din yung mga employers nila because of COVID. So, nandito sila ngayon. Yung iba, parating pa lang. And there is so much uncertainty for these nurses who are overseas. Even those that are working in very difficult employers, mga malilit na clinic, mga polyclinics, takot sila ngayong umuwi. Or tinanggal na sila kasi itong small companies, small hospital institutions are devastated by the zero income that happened during this extended lockdown sa Middle East. So these are the intervening place that creates this mental problem that we are trying to define. But it appears that our own policy aggravates our indecisiveness, our lack of forward-looking policy mindset is making life of our nurses, our highly these professionals that cannot even get jobs dito sa Pilipinas. If they can get job, it's temporary. O kaya kung nasa private na, underpaid sila, kaya volunteer sila. So ito ngayon ng, and you can see, I never saw nurses that cry. But they are crying. Kasi nandun yung uncertainty nila. Now, I would like to go back to before COVID situation. Ito naman ang problema namin mga recruiter. And having been an OFW myself, it's very painful for me to finalize the selection of a nurse na bagong panganak. 2 months pa lang yung anak niya. 1 month pa lang, or 4 months pa lang, 5 months pa lang. At talagang hinahanap mo yung kapamaraanan na talaga bang kaya mong iwanan yung anak mo? Talaga bang maasikaso ng naiwang pamilya yung anak mo? And you can see nurse saying yes po. And but in your eyes you can say it's painful. So these are the realities that I've observed over the past year as a recruiter. So siguro yun lang gusto ko may contribute. Wala akong katanungan. Maganda po yung mga topic. Kaya lang may napakahalaga ngayon, nakakaiba yung dinulot ng crisis na to. The financial impact of this uncertainty is so much for our workers. Whether they are domestic workers, ganun din po ang mga domestic workers, wala pang job order sa kanila eh. And to our highly skilled, highly professional na mga nurses and engineers, the same. The uncertainty of having unable to continue what support they have been providing to their families. May mga anak na nasa kolehiyo pa is so hurting to them and even to us as the recruiters. So maraming salamat po.
Thank you very much, Sir Lito. So any other questions or thoughts that you would like to share for anyone? Actually, may tanong rin po ako eh. Kasi regarding this mental health, first aid and all the stuff. Kasi you've discussed that you have to be sensitive when you talk with people who are in distress. There are certain cases na yung kakausapin mo, distress talaga, nag-open up all this time. Paano naman if there's this case na alam mong talagang distress siya pero never talks, very silent. Parang kahit anong tanong mo, nothing. Parang parang may malaking shell na hindi mo maka-crack open. Ayaw magsalita, kung may tatanungin mo, wala. Tapos there's another case naman, paano naman yung kahit anong tanong mo, babarahin ka naman. Yun, kukontrahin lahat ng sinasabi mo. Paano yung interventions that you'll do for those two cases?
Okay, that's a very good observation, Sir Lance. When that case happens, you don't have to talk. You just have to respect the silence. That is non-invasive respect. No? In other words, you cannot force the person to tell you her story right away because he is not prepared. But your presence will be very comforting. You just have to assure her or him, if you need to talk to somebody, rest assured I'll be available for you. I'm just here for you. That's you don't have to force because that's even more harmful, no? When you squeeze the other person because that can be very intrusive. And for all you know, he might be simply preparing her thoughts. No? Kasi at that point in time, she is still in shock, no? Or what. So but by showing the person that you are just there, then that will be more than enough. Okay.
Oo, kasi meron instances na nasa-stress ka na to the point na, tayo magsalita nito, how can I help? Kung wala naman sasabihin, yung mismo magbibigay ng help yung nasa-stress. Kasi hinihintay nila mag-open up eh. May mga ganong instances. So, kailangan talaga patience.
That's the issue of the person giving because she felt she is not needed. When in fact, the fact that you are there is already an assuring presence. But if your issue is you want to barge in, you want to force the person to talk because you also want to feel needed, then that is your personal issue. That's why before you go there, you have to ready yourself. I am not there for myself. I am there for the other person.
That's
so
correct.
that's
Yes.
very important, yes.
So the same rin yun sa scenario, kunyari, the person that you want to talk to is lahat ng kahit anong interventions mo, kinokontra ka. Ganun din ang technique rin doon? Or is there an alternate technique for that one?
What do you mean by kinokontra ka? Baka
highly resistant. Kunyari, may tatanong, kamustahin ka, bigla ka nalang kokontrahin or alam mo yon, nagdi-deflect ka nila. Kasi may ibang ganun tendencies eh. You just say something, bigla kang babarahin. Or paano naman yung ganong approach? What is the approach for that method?
So just let them be for a while.
Yeah.
Okay? If they think they still, because they might be on denial as well. The fact that they are resisting means there is something that really hurt them so much, but they cannot still accept it. And it takes a while to process. And if you're starting to investigate, to probe, then they might feel threatened. No? So just let them. Okay? So because if they think they will need you, I think they will be the first to tell you. So you can just assure, okay, at this point in time, you may not need me, but rest assured, I'll just be there in that table. If you need me, if you're family, then you know where to look for me. So give them that space. No, that can be very assuring.
So patience is a virtue talaga. Kung
Yes.
ganun ang... Opo. So, many other questions? Merong other concerns that we would like to hear from the other participants of their concerns? You may raise your hand so that we may acknowledge you.
Miss
There's from
Annie, I
DSW.
think. Yeah.
Yes, Miss Annie, yes.
Thank you, Doc Jerry. It's very and also kay Nhpss. It's very comprehensive. Again, another session na marami talaga akong parang review. Gusto ko lang ding i-confirm, Doc, kasi ngayon more on telephone counseling kami. So you are also telling us na the mere presence, your presence there, giving psychological first aid is really one way of providing them support. Pero sa case namin ngayon, usually ang process namin dito sa embassy, they will be sending emails to us requesting for welfare assistance, and then they give us their telephone number. So kami ngayon yung nagre-reach out. Most often than not, hindi talaga masyadong effective yung pagka-telephone counseling. Talagang still yung face-to-face encounter or engagement. Kasi nakikita mo dun yung yung non-verbal behavior. Maaring sa telepono, magsisay siya ng yes, meron siyang na denial, pero in a real situation, iba pala yung kanyang nararamdaman, iba yung kanyang gustong mangyari. So it is very, very challenging on our part to know what really is the problem. So instead na parang psychological first aid, still agad yung sa counseling agad yung kung ano ba yung ano ba yung mga currently na situation na nagbibigay sa kanya ng distress at saka stress. So yun muna siguro, yun muna ang palaging kumbaga sa amin ng mga social workers, starting where they are or where the client is. Tingnan kung ano yung kanya munang sitwasyon, and then tama yung sabi nyo na makinig muna, pakinggan, at saka yung also the giving, asking the right questions. Kasi kung minsan even for counseling and psychological first aid, napakahalaga yung tanong, anong klaseng tanong. Hindi dapat palaging yung sa feelings para hindi sila makapag-deny kung ano yung kanilang tunay na nararamdaman. Pagka nga hindi mo siya kaharap, hindi mo siya nakikita, ang hirap mong i-assess kung ano talagang interventions ang pwede mong maibigay. Basically, ang hinihingi nila is financial. Pero kapag nag-prove ka na ng ano talaga yung kanilang pangangailangan, palaging it will boils down do sa mental health din nila. So, it's very, very crucial na kailangan ma-identify mo kaagad kung ano yung kanilang, kumbaga, anong first aid ang ibibigay natin sa kanila. Otherwise, tapos yun ding aming capability to immediately provide the financial assistance that the client is requesting. So ang hirap din noong ipasabi sa kanya na we have to wait and we have to get specific requirements. We also have to follow government accounting and auditing procedures. So marami kaming mga challenges, pero ang pinakamahalaga din doon ay yung they feel our presence, our support, at kung ano yung talaga yung makakatulong sa kanila na makawala sila doon sa feeling of helplessness. Yun sa akin po yung doon na magandang natin dito sa PFA na, at yun nga yung sinabi mo kanina talaga na non-judgmental attitude and listen, makinig. Yung active listening po talaga yun ang pinakamaano na natin. Thank you, Doc.
Actually, that is a very good point that you raised kasi it can also be a problem of language. Kasi siguro isipin din natin na mga domestic workers, okay kung mga literate, high-end, so they can explain. But there are those who have difficulty also explaining. Kasi it also happened to us in Tacloban. When we went, we were all eager to go to Tacloban to assist. Kausap namin, hindi marunong mag-Tagalog. Puro waray. So, wala na, useless ang aming presence. Kaya ganoon din kahit sa embassy, sa ibang bansa, na baka they came from different regions and they do not know also our own language. So that can be a very, very big problem for you, the officers, to reach out. No? Kasi baka hindi nila masabi kung is it exactly what I need. No? So that is one that perhaps we also have to consider. No? Kasi the level of education also that they had. No? Baka they have that difficulty. But when it comes to need, definitely, we all have similar needs. No? When it comes to our basic human needs, housing, clothing, and shelter, security, ito talaga pinaka-basic natin, which perhaps they will know that you are there for them.
Can I add to that? Okay, yeah. I think what is very important also, kasi we also do telecounseling now, yung you listen to the tone of their voice, di ba? So usually when they stay and then medyo kabado sila, you say, oh, what can I do to help you? So you give them that kind of reassurance so that when they see that your voice also is motivating, kind, comfortable, then they will open up eventually. Pero yung kailangan talaga nila that they know that you're there, they feel secure, comfort, acceptance. I think those are the basic needs that are needed for them to feel secure.
Okay, thank you very much for that one. Talagang very challenging ang times ngayon because we know that yun nga, iba-iba yung cases ngayon, lalo na yung telephone. It's another dimension of how to counsel. So, we have another question here. May we call on Paul? Let me check. Paul, can you please?
Hello, good afternoon. Can you hear me?
Yes, loud and clear. Yes.
Okay, hello, Doc. I would just like to ask a question. Actually, what we're doing right now is we're learning on how to address these issues, these mental issues, for our distressed and displaced workers, right? Overseas workers. But the thing is, as we all know, correct me if I'm wrong, it is not in the culture of the Philippines that they are receptive to these kinds of approaches. So my question is, what's going to be the best approach, or what's going to be the best thing to do for us to be able to impart this valiant effort that will definitely benefit them in terms of mental health?
Okay. So where are you coming, sir? In what area?
What do you mean, what area? I'm actually, I have a group of overseas Filipino workers. They're almost 13,000 now.
Wow.
And actually,
Okay.
and the stress that they are feeling in our group.
Usually, when they feel secure with the community that they find themselves in, that's already very assuring, no? Especially if you are in the foreign country, okay? At least they know that they are with their kababayans. So that's one. Perhaps second is what services do you provide? For example, no? When it comes to somebody who is responsible to listen to concerns that are very personal, do you provide that also for them? Because they may not also simply need legal assistance, but they may also, as you said, mental health assistance, like in terms of somebody who is there to listen, somebody who is there that they can really confide with, okay? So even this alone can be already more than enough. And if that will be enough, if they need other concerns, I think they will also address that. No? But what is very important is you need to assure them that on their own they can be resilient, okay? Because we cannot simply decide for them. They have also to decide for themselves and stand for themselves. If they know that they have that assurance, then I think you are giving them what's best for them. No? Kasi we cannot make them dependent on you also all the time. No? Especially, so the person can bounce back if he knows that he is also getting the resource from her own strength too, no? And then perhaps the other livelihood projects that you may offer may simply be a bonus or an add-on to sustain the person.
Thank you very much, Doc.
Yes.
Yeah.
Yes,
I might, yeah, sorry. Yeah, I might add, no, if you have this time for meetings with the migrant workers, like if you have meetings, support group and all, maybe you can have a topic just for preventive measure. You can have a topic na ano yung mga trigger points ko sa stress and all, so that they get to know, di ba? So what can I do kung alam ko na-trigger na naman ako, what are the steps? So even before it has happened, meron ng a session with them, no? So that if ever mangyayari ito, meron ng pang ano, how will I call it? There's something already to hold them, no? And there's something already that they know what to do. Okay? And then that will also be good information for the embassy or for the organization, pang alam yung mga trigger points, and you can come up with some workshops for that perhaps to help.
Or a regular meeting, no? Monthly, once a week or once a month meeting can also be socializing. Can be also a way to know that you are safe with your community. Huh?
Dr. I have a question, a follow-up question. With that being said, would it be possible for us, for me, for say, for example, for me to share what I have learned here in our webinar?
Yes. This is our purpose. Yeah. Please do. Because
Okay, thank you very much. We have here a chat-in question from Miss Mary Joy, Barcelona. So, ang tanong niya, hi Dr. Paz. My question is, how to handle the case if the situation would trigger the person?
Again, Sir Lance?
Sabi daw, how do we handle the... My question is, how to handle the case if the situation triggered the person?
How to handle... So what is exactly the case?
Yes.
It's very vague.
I'll call on Miss Joy first so that she can clarify that.
Okay.
Miss Joy?
Yes po. Like kasi we also handling cases, although we have a social worker in-house, pero like with our experience po, sometimes when we have our like meeting or discussions and nagti-trigger po sa because of the activities, para pong meron yata kaming nadi-discuss na nag-trigger sa kanila. So minsan yun po, paano po ba i-handle yung mga ganong situation po?
Okay, that is very interesting. If the situation is triggering, in other words, is it a sign of burnout? Is it a sign of compassion fatigue? Or is it a sign that that situation may make them remember some unpleasant experiences in the past? So perhaps if that can happen, I would perhaps talk to the person in private and rather than put her on the spot kasi she might be defensive. What is the threat? So you can inquire, what is the threat? What was she thinking when this situation? What was in her mind? How come this is triggering a negative response from her? So from there, if she can elaborate and explain, so the solution may be halfway because you will know already where it is coming from. Kasi it's so presumptive on our end to know what is exactly in her mind. What is her perspective? Okay, so we have to hear it from her end so that from there we can assist. Kasi baka ang ibibigay mong yung solution will not be fitting. It might even be more harmful. No? So kung sa tingin niya halimbawa, binibigyan mo ako, siguro na-remind ako na I am overwhelmed or I am already, I may not be telling you that, but actually my behavior is telling you para hindi ko na kaya. So that can also be a message on the leader to, okay, perhaps she is not prepared. We may give this to somebody else who is ready. No? Rather than push the issue, o sige, ikaw pa rin. Because it might jeopardize the work. It might jeopardize the effort, and you may not be able to achieve what is it that you want. So perhaps a good conversation with the person may shed light on the burden that she may be faced with. For all you know, baka problema sa asawa, hindi siya pinapayagan na pumunta sa area na yon. No, for all you know, may kilala pala sa doon na hinahunting siya kasi marami siyang utang. Kaya if you bring her there, that will be very dangerous. So we do not know that, but at least you know na she is not comfortable. No? So that's already a message. And from there, so you can converse with her, okay, and shed more light on the issue para as the assisting person, then you can facilitate, no, how she will go through it and decide for herself what's best, no? So that she can be productive. Okay? Kasi mental health is you have to realize your potential, you have to be contributing to society. Ikaw nagtatingin niya, that is not making me realize because it's adding to my stress. So talaga her mental health is compromised because she will be resisting already, and she will not be a good player na with the team if she becomes a problem rather than a team player for that matter.
Thank you
So
very
that's my
much.
take. No? Yes.
Any other?
May I add?
We have still one more room for one more question. So or thoughts from the participants. So I would appreciate if you could just raise your hand or just press on the chat button so that for your concerns. We still have one more room for questions. Any other questions, reactions? Please feel free to share from the rest of the participants. Thank you very much. There's another one pala. Kay Sir Lito, let me read it out. Ang sabi niya is how to handle T-boy. Ito, I think how to handle T-boy female nurses who use her authority and seniority in the job site to make new arrival beautiful nurse as their forced girlfriend. Paano daw yon? I think we'll call Sir Lito just in case for clarifications. Dali.
Okay. This is a very good question, but for all you know, we already have the Safe Space Act. If you may be a T-boy, but it can also violate, okay, the safe space of the other person by harassing the person. Then she may be liable because it's not safe. So there is already that Safe Space Act for us. It's a law, and that can be a very good answer to a concern like this, no? If the person is using, no, her, or it can be another. There are two: Safe Space Act and sexual harassment. If the person is using her position of authority, okay, to harass a subordinate, okay, in that case. So there are two laws that you can okay make use of.
Doc,
Yeah.
married din yung T-boy sa Pilipinas.
Yeah.
Problema namin, palagi namin magiging problema yan sa job site sa mga ospital. And kalimitan na pinapagalitan ako ng mga HR director. Lito, why you are unable to differentiate and as much possible you don't want you to recruit effeminate or T-boy looking nurses. Sabi ko, kaganda nila. I can't hardly find kung sino yung may tendencies eh. Ang problema, napaka-possessive nila sa job site, itong mga gaytong kababayan natin. And yung pinaka-problematic na encounter ko, married din dito, may pamilya eh. So I don't know really what to do.
But Sir Lito, it can also be discrimination if you are using sex to discriminate. It's not also acceptable. Yeah, they may be masculine looking as long as they are productive and very, they don't harass anybody. But if you use that also against them, then that will also be against you. Now you are using gender as a factor of discrimination. No? So what is important is
that's true. Yan ang mga quandaries ng mga recruiter, Doc. And we encountered that really. It's not, this is really an encounter that I have. Yeah. When I arrived in Saudi Arabia for a visit, two HR directors talked to me about it. And how can we help this problem? Kasi pag nag-resign yung isa, halos yung kabila, pipirsa niya mag-resign at lumipat uli kung saan siya lilipat na hospital. So naging obstacle. And yet some of them are married. May family rito sa Pilipinas. Yeah. Kaya kung i-disclose namin sa family, parang napakahirap eh. Hindi mo alam kung anong gagawin. Anyway, thank you for that.
I guess they will need their own personal counseling na yan after it has been addressed. Yeah.
Thank you very much. Time check. It's 7 minutes before 5. Thank you so much. We had so many good insights and very interesting insights from our participants. And we would like to thank the participants and as well as Doc J and Doc Paz for your concern, for your reactions, and for clarifying certain matters with us. And now may we call back on Ms. Mel for her closing remarks.
Friends, I think this part has done the hugest improvement or change in the last few months, because this was a part where we were actually
Yeah. So thank you for that very engaging open forum. Yeah, but now we have to close. And in closing, we'd like to thank Professor Aurora Habate de Dios for her welcome remarks. Our two distinguished speakers, Dr. J and Dr. Paz, for their very comprehensive and informative presentations. And of course, Lance for facilitating our open forum. Thanks to everyone for your active participation in this first training workshop on mental health and psychosocial support services, psychological first aid, stress management, and coping strategies. We will be sending you copies of the presentation later. Our next webinar will be on gender-based violence and migrants' rights on November 19, which is Thursday, from 2 to 4:30 p.m. Our speakers will be Professor Aurora Habate de Dios and Dr. Jean Encinas Franco. She's the Associate Professor at the UP Political Science Department. Hope you can join us also on Thursday. Again, thank you very much, everyone. And let's all keep safe. Thank you. Bye.
Thank you to our participants from outside of the country.
Thank you, everyone.
Thank you,
Salamat po.
Dr.
See you po on Thursday.
And to Janine, to Miss Jane Jose. Thank you.
Hi, ma'am.
Hello, thank you, everyone.
Thank you din po. Hi, ma'am. Nice seeing you po.
Late ba?
Bye.
Bye.
Thank you
Rex
po.
on there. Thank you.
Thank you din po. See you next next webinar.
Tuesday.
Bye po.
Hi, ma'am. Kumusta po? Hi, Cecil. Thank you.
Nagaya yung mga intro nila.
Thank you po sa lahat.
Bukas gagawa 500 daw, ma'am. Bukas gagawa ka. Yung bulatan na yan, nakakatapusan niya na. Ma'am, 16 na, ma'am. 16 na, ma'am.
Salamat po.